Today, we're going to talk about something that I think a lot of us have probably wondered about at some point: tolerance. It's that moment when something that used to work, well, just doesn't anymore. We're going to break down what that really means for your body and your health.
Have you ever experienced this? That feeling when a medication, a drink, or any substance really just seems to lose its punch after a while? So why does that happen? And no, it's not just in your head. There's a really fascinating process going on inside your body, and we're about to get into it.
All right, let's dive right in. What is actually going on when that effect starts to fade away? Understanding this is absolutely the first step to understanding the whole picture of tolerance. So, here's the bottom line. Drug tolerance is just your body's response getting weaker over time. This means you need more and more of that substance to get the same feeling you got at the very beginning. And it's so important to get this. This is not about willpower. It has nothing to do with weakness. It's pure biology. It's your body doing what it's designed to do: adapt.
Okay, but how? How does our body actually pull this off? It's pretty amazing when you think about it. Our bodies are incredibly smart machines with these powerful systems already in place to protect us. And believe it or not, it's those very systems that build tolerance. Let's look at the science.
Think of it like this. Your body's number one job is to keep everything stable, right? To maintain balance. So when you introduce something that kind of throws a wrench in the works, your body immediately goes into overdrive, trying to get things back to normal. And that whole defensive process, well, that's what builds tolerance.
And it does this in two really clever ways. First, you've got metabolic tolerance. This is like your liver, which is the body's cleanup crew, just gets way faster and more efficient at breaking down and flushing out the substance. Then there's cellular tolerance. Imagine your cells have these little docking stations called receptors. Your body can actually reduce the number of these stations or just make them less sensitive, so the substance has fewer places to land and do its thing.
What's really wild is that this whole process can happen at two totally different speeds. You've got acute tolerance, which can pop up super fast, sometimes even after just one use. And then you have the one we're probably more familiar with, chronic tolerance, which is that slow, gradual buildup over weeks, months, or even years.
So we've established that tolerance is a natural biological thing. But, and this is a big but, this is where it can start to get really dangerous. It can kick off a pretty scary cycle. And this is why understanding the science is just so critical for our health.
And this is what that cycle looks like. It starts off simply enough, right? Tolerance builds, the first dose just doesn't hit the same. So, what do? You take a higher dose to chase that original feeling. But here's the problem. As the dose goes up, your risk of overdose skyrockets because you're getting closer to a level that can shut down vital things, like your breathing. And eventually, your body gets so used to the substance that it feels like it needs it just to feel normal. And that, right there, is the slippery slope into physical dependence. And just to show you how tricky this can get, let's look at opioids. With opioid tolerance, you need higher doses for pain relief. But get this, it can actually cause something called opioid-induced hyperalgesia. It's this bizarre, cruel twist where the very thing you're taking for pain ends up making you more sensitive to pain. It's a perfect, if terrifying, example of how the body's attempts to adapt can seriously backfire.
And the risk here isn't just about overdose, as scary as that is. Constantly taking higher and higher doses puts a massive strain on your body, your liver, your kidneys. It can mess with your cognitive function. And, as we've seen, it creates a clear path toward addiction.
I know, this all sounds really heavy. And honestly, it is. But please hear me on this. Understanding the problem is the first step toward a solution. And the most important thing to know is that there is a path forward. There is absolutely hope.
So the big question is, can you actually break this cycle? Can you get back in control? And the answer is a resounding 100% yes. It is absolutely possible. It takes the right strategy and the right support, but it's achievable.
So how do you do it? Well, there are a few proven strategies. Things like tapering, where you work with a doctor to slowly, gradually reduce the dose. This gives your body a chance to readjust without a major shock. For some medications, there are medication holidays. Basically, a planned break to let your body reset its sensitivity. And of course, there are alternative therapies to get at the root of why the substance was being used in the first place. But the common thread through all of these, you need support. You need professional guidance.
And that's really the heart of the issue, isn't it? Finding support that actually works with your real life. Because for any treatment to stick, it has to fit into our messy, complicated, busy lives.
You know, for so long, it felt like the only real option was to just drop everything. Your job, your family, your entire life, and check into a facility. But that model doesn't work for everyone.
Addiction is a chronic disease, and we're realizing we need to treat it that way, as part of a person's ongoing life, not separate from it.
And that's where this newer model of treatment comes into play. I want to introduce you to a program called RecoveryCNT. It was built on a really simple but honestly revolutionary idea. What if you could get top-notch, effective addiction treatment right from the comfort of your own home?
So what's the difference here? Well, first off, it can be incredibly effective because you're learning to manage triggers in your actual environment, not some isolated bubble. It helps lower the stigma, a huge barrier for so many, by treating addiction like any other chronic health condition. It's designed to fit your life, so you don't have to quit your job or leave your family. You get help in real time, right when you need it. And critically, they've worked to make it affordable by being in-network with all the major health insurance providers.
Look, if there's one thing I want you to take away from all of this, it's this. If you or someone you care about is stuck in this cycle, you are not alone. You're really not. There are people out there who get it, who are ready to listen, and who will not judge you.
Making that first move, picking up the phone, I know it can feel like the hardest part, but it is also the most powerful thing you can do. It's a sign of incredible strength. So, if you think an approach like this could be the right fit, please reach out. You can call RecoveryCNT at 1732-484-9661. Again, that's 1732-484-9661. Or just visit their website at recoverycnt.com. Help is there, and it's ready to meet you where you are.